This information is for anyone considering having their baby by cesarean section when there is no medical reason to do so. As you watch this video, write down any questions you may think of so you can ask your midwife or doctor at your next visit. Discussing the information you learned in this video with your doctor or midwife may help you decide whether planning a cesarean or vaginal birth is best for you. A cesarean section or C-section is the birth of a baby through a surgical incision in the abdomen and uterus.
What's the difference between an elective C-section and an emergency C-section?
When a cesarean section is scheduled in advance, it's called an elective C-section. When a C-section is done prior to labor due to an unforeseen complication or during labor for any reason, that's called an emergency cesarean section.
When is a C-section needed?
Well, your doctor may recommend an elective or emergency C-section if there are medical reasons that make a vaginal birth too risky to you or your baby. One may choose a C-section for no medical reasons, but this is very rare as it involves major abdominal surgery. However, there are those that make this choice for social reasons, such as severe anxiety, past trauma, previously complicated birthing experiences, a history of complicated births, or an excessive fear of pain. It is important to note, though, there are multiple effective pain management options available to you for labor. No matter how you plan your birth, having a baby always comes with a small risk of complications. It can be difficult to choose between a vaginal birth or an elective cesarean, as the risks for both are fairly low and the associated risks can be different. In general, a vaginal birth has the least amount of risks to you and your baby. A C-section performed during labor has a higher risk, and the risks of a C-section performed prior to labor starting fall somewhere in the middle. If you're considering having a baby by cesarean section, it's important to understand the risks associated with a C-section to make the best decision for you. It may be helpful to compare the chance of each risk associated with cesarean sections with these examples of risks involved in everyday life. A common risk has a 1 in 10 to 1 in 100 chance of happening. You compare this to the annual risk of being injured in the workplace. An uncommon risk has a 1 in 100 to 1 in 1,000 chance of happening. You can compare this to the risk of giving birth to a baby with Down syndrome. A rare risk has a 1 in 1,000 to 1 in 10,000 chance of happening. You can compare this to the annual risk of being diagnosed with breast cancer. A very rare risk has a 1 in 10,000 to 1 in 100,000 chance of happening. You can compare this to the annual risk of dying in a motor vehicle accident. So a cesarean is a surgical procedure and comes with intraoperative risks. Risks may include excessive bleeding or hemorrhage, the need for a blood transfusion, and or a hysterectomy, which means removal of the uterus. There can also be damage to the surrounding organs and tissue, which may require further surgeries. Also during surgery, though it is uncommon, the doctor may cut the baby's skin. There is a higher risk for you of death during a cesarean birth. The death rate from a cesarean birth is 5 times that of a vaginal birth. But keeping that in mind, it is still very rare in either case. There is also a higher risk to the baby, and that the baby may need resuscitation during a cesarean birth. The risk for you following surgery are a longer hospital stay and recovery, infection. There may be more pain at the site of incision and a greater postpartum pain. You may get severe headaches or other complications from the anesthetic, though serious complications are quite rare. Rarely, patients may suffer from blood clots in their legs and in their lungs. For the baby, there is a higher risk of breathing difficulties, and admission to the special care nursery for a short time after the cesarean birth may be required. That puts you in separation from your baby. Cesarean sections are associated with the following risks to you in future pregnancies. There is a greater chance for you to have another cesarean section. There is also a higher risk of problems with how the placenta attaches itself to the wall of the uterus. And these complications can cause severe bleeding or the loss of the uterus and can also be life-threatening. After one cesarean birth, there is a moderate increased risk of placenta complications, but after 2 or more cesareans, there is a higher increased risk. Another risk of pregnancy after a cesarean section is that the scar on the uterus from the previous cesarean section could separate. It is rare for the scar to completely separate, which is called a uterine rupture. However, more often there's only a slight separation. A uterine rupture could mean severe compromise or death for either you and or your baby. This complication happens before labor in about 1 out of every 4,000 patients having a planned repeated cesarean section. Now, it's also an uncommon risk during labor that occurs in about 1 out of every 200 vaginal births after a cesarean section.
What happens on the day of a C-section?
You'll be given your surgery date in advance, as well as information to help you prepare and know what to bring. When you first arrive to BC Women's Hospital, you'll go to admitting, and they'll send you to pre-op, where the surgical day nurse will meet you. There, you'll be prepped for surgery. You'll be given a gown, and an IV will be started. The anesthetist will discuss your pain management options with you at that time. Now, most patients choose a spinal anesthetic for an elective cesarean section. Next, you'll be walked to the operating room, or the OR, and there you can have one support person with you in the OR. They'll be given scrubs and brought in once you've been prepped for surgery. Once you're in the OR, you will get onto the operating table and be in a seated position. The anesthetist will start your spinal anesthetic by injecting the medication into the fluid in your spinal cord using a very thin needle. You'll start to feel this right away. Soon the lower half of your body will be completely numb, but you'll still be completely aware. It is quite common to have uncontrolled shaking as a result of the medications. Also at this time, it's quite common to feel anxious or anxiety. If you do, and if you can, try to take deep, controlled breaths to help relax you. So in through the nose, out through the mouth. At this point, you'll lie on your back with your arms on supports out at your sides in a T position, making it easier to monitor your vitals and avoid contaminating any sterile fields. Next, a urinary catheter will be inserted into your bladder, and your abdomen and groin are washed with an antiseptic solution. Now, the solution will dye your skin and could take some time to wash off. For safety reasons, straps will be placed over your legs to help hold you to the table. Your abdomen or belly will be draped with sterile material. A drape will also be placed above your chest to screen the surgical site from view and any possible contamination. Once you'll be assured that you can't feel anything, they will make a small horizontal incision just above the pubic bone. The doctor needs to cut through 7 layers of tissue to reach your baby. Approximately 5 to 10 minutes into your surgery, your baby will be born through your uterus and abdominal incisions. The birth of your baby will often require considerable pressure and tugging that you will be aware of, but shouldn't be painful. Once born, your baby will be checked by a pediatrician. Assuming there's no complications, your baby can then be held by your support person and brought to you to see and touch. Now, the hospital encourages skin-to-skin contact as soon as possible. Next, the doctor will remove the placenta and sew up your incisions. This process usually takes 20 to 30 minutes to repair the multiple layers of tissue. Once surgery is complete, you'll be moved by stretcher with your baby skin to skin on your chest, accompanied by your support person, to one of the 6 beds in the recovery area for the next 1 to 2 hours. Again, skin to skin contact is highly encouraged, as well as early breastfeeding.
What about after the surgery?
When you're stable, you'll be transferred to a postpartum room. The typical time from the beginning of your surgical prep to arrival in your postpartum room is about 3 hours. This is where you can have other support people join you, like friends and family. Now, your spinal anesthetic will wear off gradually, so pain relief will be given through your IV. It's also good to know that you will not be walking yet. You'll still have the catheter in and you'll be on a liquid diet. It's very important at this point to stay hydrated. Within about 12 to 18 hours, your team will assist you in getting up, walking, moving to a chair, and sitting. By about 24 to 36 hours, you should increase your walking to avoid blood clots in your legs and to help with your gastrointestinal tract and get it working. And then about 2 days after the surgery, you should be fully mobile.
So when can I go home from the hospital?
Well, on average, you'd stay about 48 hours after surgery. Now, recovery is different for everyone, but the criteria for discharge from the hospital are: your pain is well controlled, you're up and walking around, there are no signs of infection or bleeding at the site of the incision, you're able to eat, have a bowel movement, and pass gas, meaning your gastrointestinal system is working normally. Before you go home, a discharge nurse will talk to you about your recovery and your baby's health, including when it's time to call and possible what-if scenarios.
And the recovery, what is it like?
Well, once you're home, it's important that you rest. You have to allow your body time to heal. You'll need to avoid any strenuous activity or lifting anything heavier than your baby for about 6 weeks. Make any arrangements ahead of time to have support people assist you in your recovery. This may mean that your partner plans to take some time off. It may be that you have family or friends come by every day so they can help you with things such as caring for the baby, cooking, cleaning, having a shower, or helping out with any kind of other chores. It can also be important to continue walking in small amounts, even if it's uncomfortable, because it helps support healing and prevents blood clots.
Okay.
You'll be prescribed pain medication that will be safe for you to use while breastfeeding. We recommend that you take enough medication, that you're not in a great deal of pain, but be careful not to completely dull your pain, as you could risk overexerting yourself and delay the healing process. I mean, remember, pain is a good indication that it's time to rest.
So what happens if I go into labor before my C-section date?
If you think you're in labor or if your water breaks, call your doctor or midwife right away. Firstly, don't panic. You may still have options. There is a 30% chance you will go into labor before your scheduled C-section. It's helpful to think about this ahead of time, plan what you might need to do in case you find yourself in this scenario, and keep an open mind. If you're in the 30% who go into labor before your scheduled C-section, there is a 60% chance you will have a vaginal birth. You may find that you're managing the labor process better than you anticipated, and perhaps the reasons you chose an elective cesarean no longer are an issue for you. Other reasons you might end up having a vaginal birth include a relatively quick labor with no time for a C-section, or perhaps other medical reasons why a vaginal birth is preferred. Depending on how your labor is progressing, you may still be able to choose a cesarean section. The difference is that because you're now in labor, it's an emergency cesarean section, even though there are no complications. And you're not guaranteed to have your familiar obstetrician. Most likely, it'll be the obstetrician on call at the hospital that will end up performing the procedure. Remember, you're not alone. Ask for help when you need it. Your healthcare providers are there to do their best to support you. Thank you.